My name is Dr. Thomas Schuler. I'm chairman of the Medical and Scientific Board of the National Spine Health Foundation.
Hi, I'm Tao Allen. I'm a fellowship-trained physician assistant.
So Tao, tell me a scenario that you hear commonly in clinic, or just an example of something, and then we can talk about it.
Sure. A young father in the middle of the night bent over and picked up a toy, and then he had sudden severe back pain and his back is in spasm, and he cannot move, and it's hard for him to get around, and he missed work.
Yeah. So what do you do? What do you think it is? How do you treat that?
Sure. A lot of the times the root or the nature of this can be from a disc in the back that could be irritated, or inflammation of a joint which can be restricted or locked up, and the patient is in severe spasm. So the key part of this as a spinal specialist is to educate the patient, make sure that there is no neurologic issue with a good physical examination, and educate the patient on what options, what treatment can best try to minimize or eliminate the symptoms. And that comes down to good quality physical therapy and the right medications.
You know, people often are concerned that, oh my God, I bent over and I picked up this toy and now I've got this problem. I shouldn't have bent over to pick up the toy, but that's not realistic. You can't go through life afraid to move, afraid to do things, or it's not really a quality life. And so I think it's important to understand that most of these incidents that happen that lead to an acute episode of pain are going to happen anyway. It's going to happen whether it was picking up a feather or picking up a gallon of milk or picking up your kid. And it's not that you should say, oh my God, I never should have done that, because that's not realistic. And so it comes down to saying that, okay, because my discs are degenerating, or I have this motion problem, or I haven't been able to spend as much time working on the right exercise program, or I don't know what the right exercise program is, that I need to get the coaching, the help to learn what to do so I can avoid it and get over it. And I think, when people do have that acute episode in the middle of the night, the most common thing is that facet joint or that SI joint, the sacroiliac joint, they lock up, and it's agonizing. It's scary. But fortunately, it's something that can be treated fairly simply with the right intervention, which is exercise therapy, maybe an anti-inflammatory.
And for this patient, you could try to overnight to see just activity modification, just sit down, relax, don't do anything to aggravate the back, and see if it gets better on its own. Especially if it's just back pain and not any sciatica or nerve symptoms down the leg, then that patient can wait and see how he does with some time, or even over-the-counter medications like anti-inflammatories. But if activity modification and some over-the-counter medicines, if that's not enough, then it's time to seek help. And that's when you should seek a healthcare provider just to figure out what other options we have, because he's just not functional.
Yeah, I mean, the reality is, as we get older in life, we have to work harder at taking care of our bodies.